So today we will be talking about an MCQ for that is high yield for USMLE Step 2C game. So in this question, let's read. So 45-year-old. So first, I will start from the bottom too because you don't have a lot of time during the exam. So serum levels of TSH and prolactin are normal. What is the next best step? So it's the next best step question. 45-year-old woman presented with extreme acne, on her face and back. She has irregular menstrual periods with light bleeding. She also complains of excessive hair loss and thinning of hair, light bleeding. Family history significant for mother with breast cancer at age 65. She has BMI of 34, and she complains of waking up multiple times during sleep. Examination shows obese, non-tender abdomen. So from this question, if you see there's a lot going on. There is excessive acne. There is BMI is high, so the patient is obese. The patient has excessive hair loss. So acne and hair loss could be excessive testosterone or excessive androgens in a female. Also, the hair loss is the female can have male patterned hair loss if you have excessive testosterone, and then we also have irregular menstrual periods. So so far it looks like a case of polycystic ovarian disease. So in order to diagnose polycystic ovarian disease, you have something called Rotterdam criteria. You need 2 out of 3 of the following. You need hyperandrogenism, or you need clinical or on lab. Here, this patient has clinical, right? There is acne and there is hair loss, so that represents hyperandrogenism. And second is menstrual irregularities, which this patient has. And the third is, which is not shown in this patient, and that is ultrasound showing polycystic ovaries. But we do have the 2 things, and that is enough for diagnosis of polycystic ovarian disease based on Rotterdam criteria. So T3D4, TSH is already done, so that would not be a right answer. Ferritin levels, remember ferritin, excessive blood loss or iron deficiency anemia extreme level. It can cause telogen effluvium, which is often associated with diffuse thinning and hair loss in stressful situations. But here, they said just light bleeding, so I wouldn't suggest that. So then triamcinolone, this is done for a type of hair loss that you might have heard, which is really like a patchy hair loss, which is also recurrent. Remember, it can come again and again, and that is the alopecia areata. So remember, it is recurrent, and you can it can actually, if you don't treat it, it just goes away on its own. But if you want faster treatment, then you can give a steroid like triamcinolone. Then number 3 is oral glucose tolerance test. I mean, I'm going to keep that because remember, one of the complications of polycystic ovarian disease is that it can lead, because of the obesity and all, it can lead to insulin resistance and type 2 diabetes. And remember, in this case, oral glucose tolerance test is way better than other tests like HbA1c and others like fasting glucose and fasting blood glucose levels. So in PCOS, this one is better. So then we have BRCA mutation testing. This patient does have a family history of breast cancer, but the reason that this is not true is because it is at 65. Her mother was diagnosed with breast cancer at 65. So breast cancer or ovarian cancer should be diagnosed at less than 50 for this indication for BRCA screening. So hope this question was helpful.